So if people are wearing a denture, right, that they don't like, or if they have a full mouth of teeth that have to be extracted, okay, but they don't want dentures. In your office, what are the options when it comes to dental implants for this group of people?
Okay. For limited budget, we can put a couple of implants and give a full set of teeth so that the teeth would snap in, snap out. It's much better than denture. It holds in, chewing and all that. But there's a problem with that. And the problem with that is that sometimes food can get underneath it. The snaps wear out, they need maintenance. And ultimately, it's not the ultimate thing for them. And then there are a lot of young dentists who've taken these weekend courses and they can do that. And in fact, I do teach it in my course.
The snap in,
snap out as an option. But it's not the ultimate thing.
So you don't really like it? I'm picking up on.
No. I mean, it's not the best treatment for the patient.
Because what?
Because they need a lot of maintenance, because food gets underneath it, because after a while the snaps get loose and they need to go and replace it. Patients are not as happy, yeah.
Okay.
And in case of an upper one, they still have that roof of the mouth and they don't taste the food well, and ultimately they know and they feel that they're wearing a denture.
Okay.
And people don't like that. The next step would be to give him like 4 implants, and this way also dentures have to snap in and snap out. It's a little bit more secure than the 2 implants, but still it's a denture. Patients know it, patients feel it.
Okay.
What I like to do is to use the system I've invented, and I'm teaching it all over the world actually. In 2 weeks' time, I'm traveling to Asia.
So you're the manufacturer of the implant?
I'm the manufacturer of it. I'm going to Asia to give a tour about this system, is to place 6 implants for them in each arch, and the teeth are fixed for the patient.
So a full arch of teeth
that don't come out.
All right.
They get fixed, and the way we make it, it's much less expensive than all these other brands that have been around for a long time. It's the latest method of doing it, and patients are extremely happy, just like their own teeth, except we've made it for them.
How soon can they eat after the procedure?
Right
if
away.
Everything goes well.
Right away. One day they come, we sedate them. If there are any remaining teeth, we take out the teeth, place the 6 implants. The beauty of this system is we can put the teeth on the same day for them, and they can chew on it. Granted, the gums are sore and all that.
So like take it easy.
Take it easy, but the teeth don't feel anything because the teeth are directly in the bone.
All right.
Connected to the bone, so they can chew without having any pain, except the gums are sore, so they got to take it easy. And as soon as the gums heal, which is within like a week or 10 days, they can have normal diet.
They can eat whatever they want.
Oh yeah.
Can they bite like a raw carrot with their front teeth, or broccoli, or chewy things?
Ultimately, yes, but use common sense. I mean, if it's something like a raw carrot, hold off for about 4 or 5 weeks until the bone heals.
But eventually, you can eat whatever you want.
Absolutely. Eventually, after the bone heals around the implants, you can eat whatever you want. Yeah.
So nobody should be wearing dentures, in your opinion. The old-fashioned.
If I can help it, no. Maybe as a transient thing, or if financially or medically they're not ready. But no, everyone can have fixed teeth.
I've had dentists come on this show, and they say, Randy, the way you have to do is you put the implant in. You got to wait like 4 months. Then have them come back and put the teeth on top. You're saying do it immediately.
Definitely.
And they tell me that's not a good way to do it, the way you're recommending.
It depends on the type of implant they're using. The older implants that most of the people use that are designed 30 years ago, yes, you have to put them, wait 6 months for it to integrate, and then load them. But my implant design is very suitable for immediate loading, and especially when we are using 6 of them at the same time and they're all connected, they can be loaded immediately, and invariably I do load it immediately.
You do those all the time?
All the time, and that's what I teach.
And that's what you're known for?
That's what I'm known, that's what the system is known for, and I teach the immediate loading. It's a better outcome for the implants when all 6 of them are connected together from day one, rather than having 6 spots in the mouth and each of them get individual forces. It's a better way to do it.
So the upper, like 6 implants?
For the upper, same way, we put 6 implants, there's no roof of the mouth.
Full set of teeth.
Full set of teeth, very thin. In fact, the advantage of the system I invented is that the hardware on it is very, very small. It's like 4 millimeter, as opposed to the hardware for the other systems that are at least 12 millimeters. So the width of this teeth is almost the same as your previous teeth, your natural teeth. In fact, right now, we are having a discussion on one of these forums that people that use that traditional system get a lisp afterwards.
Okay.
That's because the hardware in those traditional systems is so big that the teeth will end up being 3 times wider than their own teeth, and it takes a long time, if they get used to it, for the patient to get used to it to speak without the lisp.
So there's other dentists across the country using your implant?
Yes.
So
yes.
Should they ask, like, I want, what's the name of the implant?
Implanova.
Implant Nova.
Implanova. There's
Implanova.
no teeth.
Okay.
Yeah.
And so no more dentures.
Definitely no more dentures.
Get a fixed set of teeth in just one day?
Yes, fixed set of teeth in one day while they sleep.
How old can you be to do this?
You can be, okay, typically our patients are in their 60s, 70s, but if they are healthy enough to drive to the office and sit in the chair, we can do it.
80, 90-year-old could do it?
Yes. Yes. In fact, I have noticed the time that it takes for the implant to integrate in older people is absolutely no different than a younger person. The soft tissue healing is a little bit delayed when we get older, but the bone integration, it's absolutely no different.
And they're sedated, so
sedated.
The pain is not an issue?
Yeah. The criteria is if they can drive to the office, they're fit enough, they're healthy enough. Of course, people have diabetes. Everyone has diabetes.
Right. Okay.
That's not a problem. That's not a problem.
You could have a little osteoporosis and do this?
Absolutely. Okay. Osteoporosis, yes. Osteoporosis you could have. Now, the only contraindication is if they're taking those medications for osteoporosis, and that too we can do it. Just some precautions have to be taken.
You'll work with their doctor if you have to.
Absolutely. Okay. Absolutely, yeah. But there are no conditions that right now prevent us from doing implant work on patients. People used to say that, oh, there's not enough bone. So there's not enough bone, we can put bone there. We have a lot of chemicals, a lot of bone from donors. We can take bone from the same patient. I can take their blood, centrifuge, get the growth factors from their own blood and mix it with the chemical and put that combination, which is going to turn into bone for them. So nowadays, not having enough bone is not a contraindication.
Dentures as we know them today won't even exist. They'll all be attached to something?
Of course, that's going to be the future. But in my office, that's what's happening even right now.